Hey guys, welcome to episode 3 of Joint Care series. And in this series, we're talking about joint health and joint longevity. We are focusing on two key joints in the body, shoulders and the hips. Those are ball and socket joints, which means that you've got a one bone ending with a ball and then a socket. And those joints are designed for multi-directional range of motion. We've got the structure, we've got anatomy that is made for it, and yet we're not making the most of it. So what's up with that? If you are in your 30s, 40s, 50s, and beyond, those exercises are for you. Okay, we're going through rotational movement to produce the synovial fluid in the joint. That is literally the nutrition, the lotion for the cartilage of your joint, and also moving to circulate, distribute that synovial fluid across the whole surface of the cartilage. And to the labrum, we've got a labrum in the shoulder and labrum in the hip. That's basically the outer rim of the joint that increases the depth of the joint. Today, I'm going to show you a bunch of exercises that will complement part 1 and 2, all those stuff that I showed you in a side lying position. In part 2, we mostly worked with the bands. Today, we're going to work with a Swiss ball just to help us with the setup, as well as light weights. So you can use the exercises from part 1, 2, and 3 as a daily nutrition for your joints, but also you can use it as a warm-up before training. All right, guys, so first exercise, we're gonna go through shoulder work. And today we're gonna be using a Swiss ball just to help you put your thoracic spine in a little bit more favorable position so that your shoulder blades can glide freely, okay? Bear in mind that some of us are forcing ourselves into sitting super straight, and that actually creates flat surface for the shoulder blades. But the shoulder blades are really sitting on top of the ribs, and the surface should be a little bit more rounded, just like that ball is, right? So actually kyphosis, slight kyphosis, like a roundness of the thoracic spine in here, it's actually what's natural. So we're gonna use the Swiss ball as well as some light weights. I've got 2 little weights of 1 kg. They're coming from my weighted vest. So again, weighted vest is such a great investment because you've got 30 of those little weights. You can also use plates or any dumbbells you have, something light. Let's cover the movement first. So guys, we're gonna do controlled articular rotations prone. You're going to place your rib cage on the ball. So rather than working from here, you're gonna create a more natural curve. So you see that this actually creates a bit of kyphosis, a bit of a roundness in my thoracic. And this is gonna be our base position, okay? I'm gonna drop my head slightly and send my knees further out, further apart, and also maybe tuck my toes under. So I want to stay fairly in union, right? I want to adjust the shape of my back to the ball, okay? It's quite, actually, Swiss ball is quite a good investment for this. So the simplest way of doing controlled articular rotations, we're going into flexion with thumbs up. So external rotation. You're going to send your arms out, palms to floor, keep rotating, keep spinning until your palms are facing up, and then direct your pinkies to the floor and bring your hands or tops of your wrists to the hips. You see how my thumbs are pointing up, my palms are facing you. Now I'm going to reverse. Squeeze your shoulder blades together. We're going into extension and then abduction. Rotating externally. Thumbs go to ceiling, palms go to ceiling. Lower the hands. One more time. Reach, open to the sides, send your arms back, lower the hands. Go again. Reach up and out. I'm trying again not to move my head. It's just the shoulders, and with your glenohumeral joint, your shoulder joint, you will feel your shoulder blades doing some gliding up and down, right? Upward gliding or upward rotation, downward rotation. They're going to move together and apart. Okay, now arms going. We're going into flexion and external rotation. We tucking chin in slightly and letting our arms move. You can create fists if you like. We're gonna go behind your body and see here if you can bring your knuckles together and place your hands on your back and drop your elbows. And then you're going to lift the elbows, squeeze your shoulder blades together, float your hands off your ribs and back, straighten your arms. I'm going to rotate as I'm going through the snow angel-like motion. So guys, again, this position targets all those muscles that really don't get enough work. And I'm not just talking about the shoulder, we're talking also about the postural muscles. We're talking about rhomboids, we're talking about upper, like a middle and lower trapezius, right? So that area between the shoulder blades and slightly lower, that sort of triangle in the upper back region. And those are the muscles that get, as they call it, ischemic, right? They are a little bit more stretched as we protract the shoulders and sitting this way, and they may not be getting enough blood flow, enough nutrients, and enough oxygen. So fantastic setup to wake all those areas up. And now grab your weights, and we're moving on to the same thing with light weights, okay? So literally you could have 2 bottles of water, you could have light weights, you could have 2 phones, you could use anything you have at home. You don't need to buy weights specifically for this. Okay, so again, palms to ceiling, I'm bracing, squeezing my glutes, I'm pushing my feet down, and now I'm squeezing my shoulder blades. Internal rotation, pinky to ground. Breath in, brace, straight arms. The weights, even though I'm only using 1 kgs, it's so much harder. Breath in, brace, irradiation, and then shoulder blade isolation. That's a huge difference, right? We're already using long lever, but then those weights just make it so much more spicy. Okay, so guys, that's it for the shoulders. Let's move on to the hips. All right, guys, we're moving to the hips. This is gonna be, again, quite accessible setup, okay? Because I want anyone, regardless of age or condition and current range of motion, to be able to follow along. So guys, you're going to do it standing, using the wall for support. So right hand on the wall, left leg you balancing, left hand, you can either place it on the hip or grab something like a boro block and squeeze it to the body so you can irradiate, you can stiffen and brace through this area more efficiently or more effectively. So imagine I have a wall here. This will be my setup, and you're gonna move your knee up, and then you're gonna move your leg across the body. Here, drawing a circle, going out to the side, rotating internally as far as you can, bringing knees together. Careful here, you see what's happening? Common compensation. You will want to anteriorly tilt the pelvis and move your back. Don't stack your tailbone under and kick back. This may be very limited, right? Many people have 0 extension. And then you go back and out. As you're coming back, you're going to externally rotate and cross the leg in the front. And then you're coming back, up, out, internal rotation, duct, send the leg back, extension, abduction, external rotation, adduction, and also flexion. And again, adduction, external rotation, flexion, abduction, internal rotation, extension, adduction, reverse. Okay, so guys, common compensations, you will see that your body wants to move. Your upper body should not be dancing around. Stiffen it. That's where the blocks comes in, and that's where the wall comes in. 2 more reps. Notice even the breathing. I want to take a deep breath in, stiffen, and I gently exhale. Against my teeth. Last one. Excellent. All right, 5 reps done. Let's change sides. So now, hug the block with the right arm. You're going to be standing on the right leg, left arm pushing into the wall, and you're going to be moving left hip. So let's start here. Follow along so you can follow also the rhythm and the pace. Control. Okay? With time, you'll be able to do it as a balance, but for now, don't worry about it, okay? Because we want to just focus on the hip for now. This is about the nutrition in the hip, lubrication, and covering all ranges of motion. If you start balancing, you will suddenly start feeling all the bits, and things may fall apart because of your foot, okay? Okay, 3rd rep. Stiffen, stiffen, stiffen. No hiking of the hip. And I'm going to do a couple with the wall. So I'm going to push quite hard into the wall. Go across the body. Now, if you want a progression for this, you see this? You're going to be going into figure 4. I'm going to finish you off with sort of that position. So after every rep, you could be going into figure 4 and sit back so you can get even deeper into external rotation. Hold it for 10-15 seconds, and you can simply reset from here, and that could be your progression over time. And guys, I'm showing you this in part 3 because this is a little more complex. It's not that you can't do the movements, but there will be compensations. It's much harder to control and isolate the hip. So I showed you a little more complex variation with all the sitting back, but bear in mind, you could make it very simple and go for even simpler option. Simply hold on to the wall and gently draw little circles in the air, okay? So this is your level 1, guys. Because if you're already limited in range of motion, it may be that your pelvis wants to come along for the right and you're using your lower back a lot, you're using the other hip, you're using your thoracic spine. Learn how to isolate that hip. So if you're doing it in front of the mirror, all you want to see is this hip moving. Over time, you may also consider doing it as a balance without holding onto the wall. So that's it for part 3. I don't want to keep this video too long. Try those 2 setups and see how they fit in with your daily routine. Or maybe you prefer exercises from parts 1 and 2. There's no right or wrong. All those movements will be beneficial regardless. You can do them all, or you can pick and choose. And remember that the most helpful and effective thing will be the thing you do, right? It doesn't matter which one you pick. Just pick something for the shoulders, pick something for the hips, and do it daily, okay? Just like brushing your teeth, create a habit, maybe first thing in the morning, you do maybe 10 reps of each movement for each joint. Voila, done. You can repeat this throughout the day or just do it next morning, right? Start creating a habit and you will see that restriction of motion, those aches and pains will be alleviated, okay? You're doing yourself a favor, you're doing your body a favor. Use any pockets of time you have in your day to implement this, you know? I do it frequently when I used to wait for the bus. I do it when I'm boiling water, or maybe I'm doing something for my hip or for my ankle when I'm brushing my teeth. Everyone's got time, okay? It's really about you committing to the practice. All right, that's it for today. I will see you in the next video. Ciao.